Hello everyone, welcome to Psychology 303, Analysis of Everyday Behavior. And today we're going to be talking a little bit about how we graph the data that we've collected and different ways of measuring behavior, different research designs that we can use to collect data. So we've talked a little bit about recording behavior, going out there and observing behavior, measuring behavior. But in order to really understand exactly what's happening with this behavior, it's ideal to be able to visualize it, to graph it in some way. We've recorded the data, now let's see if the behaviors are changing due to some of these interventions that we want to enact, that we want to implement. So by graphing this data, we can do a lot more with this information than just looking at numbers. We can look at a treatment or an intervention within the broader context. We can look at how stable behavior is. We can look at whether or not a treatment is effective. And we can even compare different treatment periods, especially if treatments have multiple different phases or sections. We can see maybe which one is more or less effective. In every graph, especially for ABA, there are some commonalities. Again, with graphs, we have an x-axis, we have a y-axis. Typically what we see is that with the x-axis, we see the progression of time. So day 1, day 2, maybe 1 hour, 2 hour, 3 hour, etc. And then our y-axis is whatever we're interested, the actual behavior that we're measuring. It could be frequency of behaviors, it could be length or duration of behaviors, many of those things. We can also sometimes separate the graphs into different phases, so maybe a control condition, the intervention condition, control, another intervention. We'll talk a little bit about some of those designs in just a moment. One important thing about graphs is that they need to correlate with the data that we've collected completely. They have to be exactly the same. So if we miss collecting or observing behavior on certain days, that needs to also be represented in the graph. And sometimes it's really easy so we have tools that allow us to graph behaviors, etc. Through computer modeling, other programs, but sometimes the most effective way is to just use a pen and paper, pencil and paper, to graph to see how we're progressing. So one important thing to keep in mind is we need to have a proper design beforehand before we start collecting data, before we start observing and recording these behaviors. In order to do this, we need to come up with this, all right, how are we going to organize data collection so we can have the most ideal way of figuring out whether or not the intervention is effective. We'll talk a little bit about some of the different research designs that we can use, but there are a couple things you need to keep in mind. One is that it needs to be appropriate for the behavior that you're observing, and it needs to be appropriate not only for you, the observer or experimenter, but also the person you're observing, the person whose behavior you want to change. Again, we talked previously about this. You want to tailor this kind of observation, this recording, to the specific instance, to the specific behavior, specific individual, in order to help them change their behavior. And again, a lot of different areas of psychology, you need to collect data from many different participants, from many different individuals. With ABA, you're focused on one person. You only need one individual. You need to record multiple data points for one individual, but you only need one participant to run an effective ABA study. So we want to collect many different data points, focusing on oftentimes different points in time. Is behavior changing over time? Sometimes we want to section out control and experimental groups. So how frequently did the person behave before the intervention? How does that compare to after or during the intervention? Sometimes if we have multiple different participants that we can recruit, say we're interested in a specific behavior such as nail biting, we recruit a bunch of people who bite their nails. For half of them, we put them in a control condition. We see, all right, how do people naturally, how frequently do they bite their nails? And then we compare that group of individuals to people who, if we have a specific treatment in mind, we give them the treatment and then measure, all right, how frequently do they bite their nails? And we can compare the two and see, okay, is the treatment effective? Does it significantly reduce nail biting compared to these other people who didn't receive the treatment? So either way, whether or not you have one person or a lot of people, there needs to be a lot of data points, a lot of different recordings over time that can help us solve this question. So by far the most common technique used in ABA are single subject designs. We're just focusing on one individual. We're measuring behaviors. We're looking at the antecedents of that behavior, what's predicting that behavior, and we're looking at the consequences, what is reinforcing that behavior or reinforcing the absence of that behavior. So for these single subject designs, we can have a lot of different ones, but there are some important things to consider first before deciding which design to implement. More often than not, you want a baseline. So you may have a really good idea for an intervention to use, but before you implement it, you want to record and see how frequently you perform the behavior that you want to change before the intervention. You want to get a baseline. It'll also help you kind of figure out, all right, how exactly am I going to define that behavior? Along with the baseline, you also want to keep in mind that using replication will help you better determine whether or not it's the intervention that's leading to the change in behavior and not some other variable that you're not even thinking about. So you may implement an intervention for nail biting for someone, that after the intervention people reduce their nail biting, but it might be the case that the individual just happened to get their nails done, painted their nails, and that's why they're not biting their nails. So even though the behavior changed after the intervention, it might actually be something else that led to the reduction in behavior. So if we use replication, we're able to better determine that it is the intervention and not something else, such as painting your nails, that's leading to the reduction in the behavior. So what are some of these designs? Well, we have AB design. That's where we just have a baseline measure and then treatment, so during or after treatment. There's no replication involved, so we can't determine whether or not this is a functional relationship because it can't rule out extraneous variables. And for that reason, it's not often used with ABA, but it is sometimes used for trying to determine if a specific intervention might have this effect, if it's kind of an exploratory intervention. If we want to include replication, we would shift to an AB-AB reversal design. That's where we have baseline and then treatment, and then we shift back to baseline and then another treatment phase. There are certain situations where this can't really be done. So if you think about teaching someone a technique to stop biting their nails, or if you have a child who wants to learn words, if you teach them some words, you can't really shift back to baseline because they've already learned the tools and techniques they need to be able to behave in that ideal way. So if you kind of look on the slides, you can see baseline is down below, then it jumps up for treatment and then back down for baseline. If you have this language example, it's not going to go back down. It's going to stay back up where the treatment levels are. So for some behaviors, this is ideal, but most of the time, if you're teaching someone a technique that they want to use to reduce or increase a behavior, jumping back down to baseline isn't really going to be that effective. For this reason, you might want to use a multiple baseline design. And this is probably the most common technique used in ABA. That's where we have a baseline followed by a treatment condition, or treatment phase rather. But we have different implementations of this combination. So, and across subjects design, we would recruit multiple different participants and then implement the baseline first and then shift to the treatment phase. But all of the participants wouldn't shift to the treatment phase at the same time. It's kind of staggered. This is one way of kind of ruling out any possible extraneous variables that might have to do with a specific time. So if a person is really anxious and they want to reduce some of this anxiety, maybe a really anxiety-provoking event occurs. If we have a multiple baseline design, that can rule out the possibility that a treatment isn't effective because for some reason anxiety was high due to something that was happening in the real world. We can have other variations of this, such as across behaviors design, if we're interested in how an intervention affects multiple different behaviors. And we can also have across settings design, where we kind of keep the behavior and participant constant, but implement the treatment in different settings, in different environments, to see if it's still just as effective. Another design we can have is alternating treatments design. This is extremely helpful if you have multiple different treatments that you want to compare to one another. Instead of going baseline treatment, baseline, new treatment, baseline, new treatment, you can just shift between treatments during each recording period. That will allow you to kind of be able to compare these treatments. Ideally, what you want to see is one treatment kind of stand out from the rest and not them all be kind of cluttered together. And we can also have changing criteria on design. That's where it's extremely helpful if you have an intervention or a treatment that has multiple different phases. So people going through rehab, for example, it's good to see a progression of, all right, we have the first phase. After we've implemented the second phase, do we see another increase or decrease in behavior depending on what it is that we want? But all in all, we have all these different research designs, but again, you want to decide which one is ideal for the specific behavior and the specific individual that you're interested in. Ideally, you want to try and demonstrate a functional relationship, be able to pretty confidently say that it is the treatment that's leading to this change in behavior and not some other extraneous variable. And replication, or using some of these other staggered treatments or staggered designs that we've talked about, can help us do that. So that's all I have today about research designs and graphing behaviors. Thank you all for your time and attention, and I will see you on the next video. Thanks.